Today, we're going to do a process that's called intraoral massage. What we use the intraoral massage for is actually two things. People that have what's called TMJD, where they have a jaw that's not tracking correctly and tend to, instead of coming straight down like this, they tend to go like this, which causes like clicking and headaches in this jaw area. A lot of people cannot open their mouth wide enough to get, like, for the dentist to work, so a lot of times dentists send them to me so I can loosen them up so they can open their mouth and they can talk again and be all happy. Anyhow, so we're going to demonstrate this, and one of the reasons we want to demonstrate this is because a lot of people don't realize that therapists that have special training can work actually inside the mouth. And there's a lot of things that you can do. Another thing that this is great for is relaxing the neck. People that have problems with migraine headaches and things of that nature, this is shown to be very beneficial. So, under a normal session, we would take and give a full massage, especially paying attention to the upper back and this area here, because I want to get everything on the exterior as loose as possible, because when I go in the mouth, I'm going to be working there. So we would start off with just doing motions like this. I'm going to put a little oil in my hands so I don't pull Taylor's skin off. It's not good. People get angry. But we're just going to work with just getting her nice and loosened up. Now, I've been working on Taylor today, so she's pretty loose, but we're just kind of give you an idea here. So, kind of come right up the arm, right into the pecs. Just want her just as nice and comfortable as possible. And when I've achieved that, now I go to do the intraoral work. So, what I do is I get my gloves. I put on a glove. These are gloves from Costco, just like what the doctor uses. The hardest thing is putting them on, especially if your hands are oily. You gotta figure out which one's your thumb. What's wrong with me, Doc? I don't know. Alright, that's getting better. Alright, that one went on good. Okay, here we go. So, I have gloves on, so you don't ever want to stick like a dirty finger in somebody's mouth. They don't like that. So what I do, and as I turn the head sideways like this, have the client open her mouth, and I go in, come right down, and I'm working right, if you can see, go right to the jaw, and where the jaw bones come together, you can feel a muscle right in there. Feeling that? Mm-hmm. And very lightly. This is a really sensitive area to work. Just get in here and just keep working. What I find really interesting about doing this is when you get up to the roof of the mouth, the roof of the mouth, you have an idea that the roof of the mouth is like this nice smooth dome. It's really not. It's really cool. There's a lot of different types, and that's usually formed when the head is forming at birth, the plates coming together. Sometimes they come right together, sometimes they slip a little bit. It can make actually the roof go like that. That's really cool. It's starting to loosen up there a little bit. can come right down and kind of hook right in. Have to be careful you don't get a gag reflex going here. It's not unheard of, right about where my hand is, the stationary tubes to the ears. When you start getting things relaxed, the sinuses will start draining the fluids from behind the eardrums. It goes right down the throat, and sometimes people go because they feel that stuff going down their throat, which is very, very normal. See, she just swallowed there. Now normally I would take him to do the other side, I would turn the head the other way to work, but for demonstration wise we're showing it like this. Come right down. Actually, I got my finger right under her back molar. Got a little tear in your eye.
Huh.
Okay, open and close your mouth. How's that feel?
Wow. Yeah, I can feel everything draining.
Mm-hmm.
It's shocking.
Those are right here behind the ear. There's the stationary tubes. And a lot of times when you hear like children getting ear tubes, it's because these get blocked up. So they put ear tubes in so that they drain, and really that's something that can be, with massage, can be cleared up, because you will outgrow this. That's a childhood thing. So
yeah, my sinuses have totally drained. That's amazing.
mm-hmm. Because we've loosened up the neck and started a flow going, so the sinuses drained back into the ears and then came right on down and right down the throat.
Wow.
So yeah. So think if you had a jaw that was sitting clicking or pulling to the side. I always say it kind of resembles a cow chewing its cud, because you're going, instead of coming up and down, they're actually going like this. You're grinding instead of biting. So what we try to do is try to get this jaw aligned so that the teeth come together. And it stops a lot of headaches and a lot of problems up here. All right, once again, this is Tim Cosden, and this is Intraoral Massage. So if you have a problem with any kind of jaw, migraine, stuff like this, book me right online at CosdenMassageClinic.com. Thank you.